Staff Development Defined is brought to you by iteachnurses.com. Your smart content expert. Staff development is defined as the systematic process of assessment, development and evaluation that enhances the performance or professional development of nurses and their continuing competence. The focus is on competence assessment and development. These staff development activities consist of three components: orientation, in-service educational activities and continuing education. Nurses possess expertise as direct care providers. Their experience in assessing, planning, directing, and evaluating the education needs of other staff is limited. Most RNs received formal instruction in and experience with the teaching-learning process in their initial preparation as an RN. This educational content is focused on learners such as patients and lay people. Therefore, the nurse will need additional instruction and guidance to effectively assume the role of a staff developer. The role of an instructor in a nursing assistant training program or NATAP is to follow the daily training schedule and the nursing assistant module curriculum that were approved by the California Department of Public Health. The role of the Director of Staff Development or DSD in a nursing home is limited to providing only CDPH-approved in-service training in a classroom to currently employed CNAs. The DSD is not authorized to provide in-service education online, through home study, or to charge CNAs for the education. All CNAs who are employed by the nursing home shall receive at least the normal hourly wage for attending the in-service program. DSDs need to develop a 12-month in-service training calendar that provides a minimum of 24 hours every year. All topics provided during an in-service education must be approved by CDPH on Form CDPH 278B. CDPH requires that all courses given in the approved in-service training program for CNAs must include a lesson plan for each topic that contain the following information: student performance standards, for example course objectives, a description of topics included which provides the department with adequate detail. For example, technique, method, procedure to discern what is taught. A description of the method of teaching, for example, lecture, skill demonstration, and instructor-led video or lecture. A description of the method of evaluating the results of the training, such as a written exam for theory or a skill return demonstration for clinical skills taught. Here is an example of a lesson plan that contains all the required information required by the California Department of Public Health Training Program Review Unit. In-services are required to have an in-service sign-in sheet that must include the following information: name of the health facility, in-service course title, date of in-service start time and end time, instructor name and signature, participant's name and signature, participant's CNA or HHA certification number. The skilled nursing facility record-keeping policy must include the following information: which in-service records are maintained. For example, sign-in sheets, lesson plans, written exam, etc. How long are the in-service records maintained? Note there is a 4-year minimum for maintaining in-service records. Storage location address. How records are stored. Hard copy or digital storage. The title of the person responsible for the record keeping. A nursing facility shall include a schedule to demonstrate how it will make available 24 hours of varied in-service training annually. The Director of Staff Development shall schedule a time and date that every individual shift will receive their in-service education on for each course provided. Staff Development Defined is brought to you by iteachnurses.com. Your smart content expert.